Well, what's going on, it's all good. And we just gonna continue to make it good and enjoy seeing all those smiling faces. And I am so glad to see all of you out here in the cold and getting ready for your 5 minute report. So I hereby call this meeting to order, the Community Relation Committee of Board of Directors of NYC Health and Hospital for Wednesday, November 5th. I will now call a motion to adopt the minutes of September 9th, 2025 meeting.
So moved.
Mr. Chair,
So moved.
Dr.
Yes.
Morthon. Anita.
Yes.
All in favor?
Yes.
Yes.
The minutes have been adopted.
Great.
So now I turn the meeting over to one of the best doctors I know
Oh, thank you.
for his remarks. And that's for real. He is one of the best. Don't you agree?
Yes. Thank you. Thank you.
Yes, thank you,
Okay,
Doctor.
very good. Well, so nice to see everybody. High on our minds has been worrying about people not having enough food. So with the November 1, the government shutdown, people's cards who were on SNAP funding did not get refilled. Now it's in court, and the court ruling was that the federal government had to put in some money into it, and also the city, the mayor announced 15 million in emergency funding. I know New York Health Foundation also put in $1 million. But this is also something we're going to continue to deal with, because even when the government opens, there are new rules about people having to get paperwork done in order to continue to get their food benefits. And we know that even when people are fully employed, sometimes the paperwork doesn't get done in the way the bureaucracy wants it. So we're working hard to try to figure out a smooth way so that when those work requirements start, we can make sure that nobody loses their food benefits. The work requirements do allow for disability. You can't work. They allow for taking care of young children. They allow for volunteer work, and they allow for being in school. So it's not that everybody has to work. The problem is making sure that the forms are filled out so that people don't lose benefits even though they're fully compliant with the rules. I'm not going to read every update. You have it. I want to say we're expanding very much our X-ray capability, radiology, so we can do better diagnosis throughout our system. We celebrated a baby that their parents appropriately named Miracle with a Y, because she was born at only 22 weeks. So she, if you could imagine, fit in your hand, 1 pound. And they successfully at Queens were able to nourish her, and she left 8 pounds 3 ounces and is developing normally. So really amazing. Gouverneur, where I was this afternoon seeing my patients. In fact, I'll have to ask Morris what was going on. When I walked into the clinic today, Morris, there were this group of people. Someone was giving a tour, and I was trying hard not to interrupt their flow, so I crept up the stairs. But as I'm creeping up the stairs, someone is saying, "And there's our CEO who is going to see his patients this afternoon. He works here every Wednesday." So I don't know what that was that I walked in.
Well, it's a party every time you come to Gouverneur.
Okay, well, I appreciated that.
It was Sing for Hope was there, and Arts and Medicine was there. They were giving tours, and they had musicians in the auditorium, and it was a very, very nice day.
Well, and people should know Gouverneur has some amazing World War II murals that are quite famous. Okay, so that was my funny experience at Gouv today. Natalia Sineas, who's our wonderful chief nursing officer, celebrated 16 of our nurses becoming doctoral nurses. And she has now a collection of over 130 nurses throughout our department who have gotten a doctoral level degrees. And I think it's such a nice way of showing that all of us can keep learning, can keep getting additional skills. And then I just wanted to say the mayor announced that his administration has canceled $135 million in medical debt for 75,000 New Yorkers, which I think is quite an accomplishment. With that, I look forward to today's reports.
Thank you so much, Dr. Katz. We will now hear from the facilities presenting their verbal annual report. Each presentation is allotted, what? Oh, your chorus, you sound great. And and it's real, the board, Dr. Katz, we are grateful for the work that goes into preparing them. Thank you in advance to all our speakers for their time and commitment to the system. And not only to the system, but to yourselves. Because when you present with, I got this, I love this, we need this, and we're going to continue to do this. And saying all of that, our first presenter is none other than Metropolitan. Mr. James Ratta. Ratty Cheer.
Okay. Good evening, everyone. My name is James Ratty, and I'm a lifelong resident of El Barrio, East Harlem, where NYC Health and Hospital Metropolitan is located. As chairperson of the Community Advisory Board at Metropolitan, I'm going to share the progress and initiatives of our incredible team at Metropolitan. Equipment and infrastructure. We are continuously working to improve our infrastructure and equipment at our site. This year, we installed a new MRI trailer, which serves the hub of our radiology services. The trailer allowed us to extend our breast cancer screening hours, this Breast Cancer Awareness Month. We have also replaced all of our beds and furniture in the inpatient units. I won't go through every item, but we want to share installation and completion of a new security system. Our ongoing projects include wayfinding and securing fundings to update our operating rooms. Our new infusion suite, which will bring a new level of care to our oncology patients, is 90% complete. And more often, you will hear about our new emergency department. We're in the process of pursuing funding, patient safety, and satisfaction. We are happy to share some of our achievements this year. They include a leapfrog, A grade for patient safety, and U.S. News and World Report Best Hospital. Again, I won't go through every item, but I'm proud to let you know Metropolitan Hospital is the first hospital in the world to receive Pathway to Excellence with Distinction designation. Okay. Recognizing the needs of our community, we have extended hours for behavioral health and other outpatient service lines to accommodate children and working people. We also focus on MyChart utilization for prescription refills to reduce pharmacy wait time, which is now down to 20 minutes. And all of our inpatients being discharged have medication brought to their rooms before they leave. They don't have to go to the pharmacy before going home. Our ongoing projects include focusing on MyChart utilization for appointments and communication, and focusing on patient safety and satisfaction through after-visit surveys and staff wellness. Frequent complaints by patients. At Metropolitan, we always look at what we can improve, and we work to fix it. This year, our patients told us that we have 3 areas where we have an opportunity to improve. 1, appointment availability. 2, quality of communication. 3, navigation through visits. We are addressing their concerns. Our Care Experience Steering Committee, senior leadership, and the Patient Family Advisory Council meet regularly to discuss patient issues and potential solutions. The Patients Relations team conducts press gaiety roundings. This is a department specific and allows us to discuss and improve patient experience. We share feedback with clinical departments and provide support through eye care and H3. We have increased use of patient navigators and are utilizing technology such as MyChart and telehealth visits. Issue impacting the community. The main challenges in the community we serve include substance use and dependence, morbid obesity resulting in diabetes and hypertension, mental and behavioral health challenges, and seniors facing barriers to accessing everyday resources like transportation, senior centers, and food. Our outpatient service have begun extending hours and enhancing services to address all of our needs. We have also increased our engagement with stakeholders in the community that work with seniors, children, and adolescents. Acknowledgement. Metropolitan is proud to celebrate 150 years of service to New York City and enjoys the oldest hospital medical school affiliation with NYMC. We are a teaching institution that takes pride in serving El Barrio and beyond. We thank our Metropolitan family for its dedication. Thank you to the Board of New York City Health and Hospitals and to the Council of Cabs. Our gratitude to Mr. Julian John, Elsa Cosme, Dr. Anita Sirivison, Chris Wilson, and the Metropolitan Hospital Leadership Cabinet for their dedication to health, equality, diversity, inclusion, and accessibility. Thank you.
And thank you. Great report. Any questions, Dr. Morgan?
No, just a comment. Thank you for your
Okay.
report.
Mr.
Thank you
Chia?
for your report.
I just wanted to say that since your last meeting, the appointment of Anita Srinivasan is significant in that we now have 4 women CMOs in the hospitals.
Oh.
All right. We only had 2. Three of the women doctors are women of color. So, it's another sign of, how much, we value, diversity here at Health and Hospitals, that at every level, it's important for us to be diverse at our leadership.
Anita?
I'm glad to hear about that appointment and thank you for the report.
My pleasure to give it.
And thank you once again. Now, we go to the famous Sydenham. So, filling in for our chair, Joyce Rivers, is a very active board member, Ms. Danielle Lewis McLaurin.
Good evening, everyone. Okay, so I'm on the Community Advisory Board of the New York Health and Hospitals, Sydenham. Oh, no? Oh, sorry. I'm new, sorry.
I was gonna say.
Okay, so I'm a member of the Community Advisory Board at NY Health Plus Hospital Sydenham, and today I'm going to share our progress and initiatives that highlight our ongoing commitment to enhancing our facility and community. So the first slide, yep. So equipment and infrastructure request. We continuously work to improve our infrastructure and equipment at our site. This year, we will be upgrading the dental room chairs and will continue our advocate for much needed equipment and infrastructure which need to be updated due to the age of our building. The roof needs to be repaired and it frequently leaks, and the HVAC system often fails. We need to expand our radiology offerings, but are constrained by the limited space. we need about 50 beds across our 3 sites, and furniture, workstations at across the 3 sites to accommodate small exam rooms. The next slide. Patient experience. At Sydenham, patient safety is a key part of our commitment to delivering high quality and community-centered care. The 2025 Q2 Press Ganey rate provider score was 82. We have work to do. The recommended provider office was 86, so we'll get it next year. So we follow the patient safety goals set by the Joint Commission, and work every day to ensure a safe, welcoming environment for everyone we serve. Some of our safety priorities include verifying patient identity at every visit, promoting clear, consistent communication among care teams, ensuring medications are reviewed, prescribed, and handled safely. And to help us improve, we gather patient feedback through our Press Ganey service, which are valuable insights into our experience. So the fourth slide. Yeah, okay. So the patient Ganey survey shows that the best areas relate to our staff performance, with nursing and care providers achieving high scores at patient satisfaction. Areas for opportunity lie in improving and in moving through the visit. Next slide. I'm sorry, I'm a little bit nervous, I don't know why. Frequent complaints by our patients. Complaints have been minimum in 2025, with only 6 reported to date. I think that's great. Patients may sometimes experience minor, longer wait times and delays with visits. To address these patient relations, rounds to address patient concerns to escalate issues. To migrate minor delays and wait times with visits, the sites actively communicate with physicians regarding any potential delays and will run labs or vaccines prior and between wait times to expedite visits. Okay, the 6th slide. Issues impacting our community. High rates of chronic conditions, hypertension, diabetes, obesity are prevalent, which may be related in limited access to healthy foods, preventative care, and health education. Mental health concerns, stress, anxiety, and depression are significant but often undertreated, influenced by socioeconomic challenges and limited access to care. Health access barriers. Many residents rely on emergency departments for care due to lack of primary care access, insurance issues, or clinic availability. Environmental and social determinants. Crime, housing quality, and food insecurities contribute to poor health outcomes and reduced engagement and wellness barriers. 7th slide. We are happy to share that Sydenham was certified gold for diabetes, cholesterol, and gold plus for hypertension by the American Heart Association. Accomplishments. We would like to extend our gratitude and acknowledgement to our elected officials. Leader, New York County Democratic Keith L.T. Wright, Manhattan Borough President Mark Levine, Manhattan Deputy President Keisha Sutton James, New York State Senator Cordell Clear, New York State Senator Robert Jackson, New York State Assembly Member Jordan J.G. Wright, tongue twist, New York State Assembly Member Al Taylor, Manhattan District Attorney Alvin Bragg, NYC Counsel Yusef Salam, NYPD, FDNY, St. Nicholas Tennis Association, and Dykeman Tenant Association. Thank you.
Thank you. You almost went over. But we excuse you, this your first time. So, hey, thank you so much. Mr. Chair?
Great report.
Thank you for your report.
Excellent report.
Thank you, and it's great to see that you're rated gold in the areas that are most important to the community.
Yeah, thank you.
And thank you again. Okay, so now we have Miss Delgado, the cab up Woodhall. Is Woodhall in the house? Oh, okay, Woodhall.
Good evening, members of the Board of Directors, Dr. Katz, President, CEO, and all other present community relations reporting today. I also would like to proudly acknowledge our Chief Medical Officer, Dr. Ross McDonald, that is here with us today. I am Reverend Yvette Luperena, the Chair of the Community Advisory Board at New York City Health and Hospital, Woodhall. Today, I'm going to share our progress and initiatives that highlight our ongoing commitment to enhancing our facility and our community. Next slide, please. Equipment and infrastructure. We have many infrastructure and equipment projects currently underway. We will design and replace the existing outdated generators, which will also allow us to be more efficient and overall and more resilient during the weather events. The fire alarm system is also original to the building and outdated. So we will upgrade the fire alarm system. We will renovate the labor and birthing suite, which will improve patient access and safety and promote continuity of care. We will also design and renovate the critical care and trauma in the emergency department, allowing more privacy for patients and improving workflow and patient care. Next slide, please. Equipment and also infrastructure. We will upgrade existing and original boilers and create a tie-in for an emergency boiler. We will provide a design for the electrical distribution at Woodhall, which will allow electrical service distribution. We upgraded our pharmacy equipment to install automated dispensing technology in patient care areas throughout the building and upgraded our medical beds. We also upgraded patient monitoring equipment. Next slide, please. Lastly, we upgraded equipment including hypothermia equipment, nuclear camera equipment, and histology lab equipment. Next slide, please. Patient experience staff engagement. Woodhall's Hospital Patient Safety Program continues to focus on the accurate identification of patients, ensuring right care for the right patient. Patient misidentification is the most commonly occurring errors in healthcare facilities, and it is the number one Joint Commission National Patient Safety Goal. We have active participation from every department and every discipline in the hospital. Monitoring is likewise occurring across the board without no exception, including evening and night tours. Our current patient identification campaign, Check 2 Every Time, is posted throughout the hospital and is routinely communicated to all staff via email communication. Patients and families are encouraged to speak up and actively participate in their care. We have also initiated a steering committee called Leapfrog Journey to Aid. For staff engagement, we continue to advance our culture of compassion through eye care, training and eye care staff pledge. The Service Excellence Steering Committee was introduced to strengthening the focus on the key drivers impacting patient experience. We continue to collaborate with our Patient and Family Advisory Council to ensure patients and families are actively involved in initiatives such as improving communication about medicines and other areas directly affecting their care. Next slide, please. The Helping Healers Heal H3 Workforce Wellness Program provides comprehensive wellness support designed to meet the emotional and psychological needs of all hospital staff. Our services include individual and group debriefs, referrals to licensed mental health professionals, trainings to recognize red flags and events to enhance holistic well being. Next slide, please. Patients' frequent complaints for 2024 were related to care coordination of care, attitude, behavior, and property. As a result, the following are continuous efforts at Woodhall during 2024 into 2025. But eye care is reinforced, and the difference of having agency nurses has been duly noted due to the fact that we have hired permanent nurses, which makes a difference. Continuously reinforcing the importance of compact and professional behavior training, which directly impacts and addresses this trend. Compact of professional behaviors training during orientation also for all our newly onboard staff. Communication matters training is open to all the staff. Staff are continuously strengthening collaboration with patient relations, patient experience, and departmental leadership from outpatient and inpatient areas. Patient relations provides monthly data or complaint cases to all the department's leadership, both for outpatient and inpatient areas, to provide the voice of the patients through identifying trends of improvement. We're identifying problems and coming up with solutions. Next slide. We are proud to share the many recognitions we have received at Woodhall by our U.S. News, World Report, Plaintree, American College of Surgeons, Baby Friendly USA, the Human Rights Campaign, and many others that I may not have mentioned right now, but you could look at the screen and we have approximately 20 recognitions. We also now offer new services in ENT and thoracic surgery, interventional pulmonary and pain management, among others. Next slide. Woodhall's aging facility is a constant need of costly repairs and upgrades to the infrastructure. This is further intensified by the climate change. We just had the windows cleaned, and that made a big difference. And even though it seems something simple, but we had a great outpouring of compliments from the community. And we believe that the outside structure should also reflect the inside structure of what Woodhall is. While all vacant positions also have been approved to be backfilled, it remains difficult to recruit certain titles, nursing, social work, and medical staff. We had the opportunity of additional resources, partnerships with community organizations to support patient care programs, to reduce anxiety, and to rebuild trust. Finally, please see the following elected officials on the next slide and their ongoing support for the person-centered care treatment and services provided to the residents of Woodhall. Our special thanks and gratitude are extended to our elected officials, which always come through for us, the Woodhall CAP and the Woodhall Auxiliary. And our main thing right now is we say is Woodhall is going from good to great.
Great, yes, yes, you almost went away over. But it was all good, and you know, it's important we hear this information, and I know all of you here have plenty of stuff to tell us, and we're proud of that. But 5 minutes, it's all good. Thank you so much. Keep up the good work. Is Harlem in the house? Is Harlem in the house?
Thank you, everyone.
Any question? I'm not yet. I have to sell my stuff and then I'll ask the board. You have any questions?
Just thank you
Doctor?
for your report, and it's nice to hear that you're also thinking of the outside of the building, because when I visited Woodhall, I never thought I would see what I saw inside of the building compared to the outside. And I told the board it's a magnificent layout. Like, the rooms are huge. There's so much that is being done and could be done with the building. So for people to know, for just walking down the street to see it to be more inviting, I think that's so important. So thank you for bringing attention to that.
You have to admit, Dr. Mathon, It's a strange idea that someone thought brutalism was a good idea for a hospital. That's what I always think about. Like brutalism, it's an interesting architectural movement, but I don't know that I ever would have thought a hospital was the thing to demonstrate brutalism and what it might look like.
Unfortunately, it looks like a prison from the outside.
Right, I mean, that's what brutalism is all about. And they can only do so much with a building that was designed deliberately under a certain architectural style that doesn't really seem very therapeutic.
No.
But what goes on inside of Woodhull is very
It is,
therapeutic.
it really reflects that inside.
Yes, I agree.
I believe you.
You know, why did I know she was not gonna stay quiet? What? Thank you, Mr. Chair.
Great report. I like how you laid out like all the infrastructure changes or improvements that have been made, so thank you.
That's good. Nita,
Great report, thank you.
Doctor, you have any more?
Nothing more.
Thank you again. Okay, Harlem, I know you're ready. You came in here real ready. Now I give to you Miss Michelle Booker, the CAG chair.
All right, need more coffee. Okay. So good evening, everyone, and thank you for your patience. We were moving along, so we're here and safe. Can you hear me?
No, it's on.
Oh, okay. All right, I'll speak a little louder. So good evening, everyone. I'm
Good.
Michelle Booker, and as the chairperson of the Community Advisory Board at New York City Health and Hospitals, Harlem, I'm going to share our progress and initiatives that highlight our ongoing commitment to enhancing our facility and our Harlem community. Slide 2, please. So first, we'll talk about our active capital projects. We are continuously working to improve our infrastructure and equipment at our site. This year, we are actively upgrading our boiler plant and renovating our postpartum unit and fifth floor CT procedure room to meet the needs of our community. We are also replacing the roof and the 18th and 7th floor of the MLK building. We are also in phase 2 of upgrading our data closet. Okay, slide 3. Active expense projects. Our active expense projects include installing feeders for MRI UPS and demolishing and rebuilding 2 bathrooms in the MLK building. We are also installing doors in our emergency department and will have a new clean steam generator. Slide 4. 2025 capital projects. This year we have completed upgrading the condenser water piping project in the MLK building, which is Martin Luther King building, and upgraded the HVAC equipment and cooling towers. We also acquired new equipment to better serve our community, including a GECT scanner, an ablation system, a nuclear camera, ultrasound machines, bariatric equipment, and smart beds. Okay, slide 5. Patient safety. The patient safety department was involved in many culture of safety, educational, RCA investigations, proactive risk assessment, and performance improvement activities over the last year. The Harlem Patient Safety Committee met monthly to review topics, including the good catches, of which we had 178 in the first 3 quarters of 2025, national patient safety goals, leapfrog survey, for which we maintained a safety grade of C in spring of 2025, and patient safety performance improvement initiatives. There have been 19 educational safety sessions taught to Harlem staff so far this year. Additional trainings such as Just Culture have also been conducted with staff. The patient safety team has also collaborated with Workforce Wellness, Care Experience, and Human Resources to engage employees. Patient safety continues to work on performance improvement projects, including to improve compliance to the level of observation policy and reduce Total 1 to 1 hours. Slide 6. Our frequent complaints. Our top grievance and patient categories are poor attitude, care, and communication. Patients may feel their needs are not being addressed in a timely manner or may struggle to understand their care plan and discharge instructions if providers fail to explain in an accessible way. Patients also feel that staff members are unwilling to assist them, particularly with new kiosks or technology. Grievances are forwarded to the Chief of Service for review and response with a 3-4 day turnaround time. In compliance with regulatory guidelines, all grievances are resolved within 7 calendar days. Patients receive a response letter, either by mail or email, detailing the findings of the investigation and the corrective actions or recommendations. Customer service training has been implemented to enhance patient interactions and improve the overall patient experience. Issues impacting the community. There are a number of highlights this year we are proud of. 88% of our internal medicine residents passed their boards. We are a center of excellence in surgical safety, prevention of RSI. Harlem Hospital was recognized as one of the 2025 Best Hospitals for Black America by blackdoctor.org. We are a baby-friendly institution. We have an LGBTQ plus designation. We have a robust robotic surgery program. We have been ranked among the top 160 hospitals in the U.S. for heart failure. Type 2 diabetes honor roll, specifically heart failure. There are also some challenges. As you've heard, Harlem's aging infrastructure is in constant need of costly repairs and upgrades. Our hospital has worked diligently to replace equipment that has been deemed end of life. We are working to reduce costs by converting temporary workers to permanent lines. Legionnaire's disease outbreak. Harlem partnered with the Community Advisory Board to allay concerns and disseminate information to the community. Moving forward for acknowledgments. For their ongoing support, our special thanks and gratitude are extended to our H&H Board, Chair of the CRC Committee, Mrs. Jackie Rowe Adams. We'd also like to extend our thanks to Dr. Katz, Mr. LeConte, Mr. Philip Cook, the Harlem CAB, and our elected officials who support our community and facility. Thank you all.
Oh, thank you. You might have 2 more minutes. Thank you. And, Mr. Chair, any
No,
questions?
thank you for your report. Very thorough.
Dr. Katz?
All great. Wonderful things happen at Harlem.
Thank you. Thank you. Thank
Dr.
you for your
Martha?
report.
Nita?
Thank you.
So I just want to say, the Legionnaire, just touch on that. I'm glad you brought that up because I've been working closely with HR and Dr. I made him the doctor, but the CEO, Mr. LaCar. And it is dying down. I'm talking about in terms of the community with criticism and being scared to come to use the hospital, but we got that. And it's all about getting out there, giving out information. It's an information piece. So thank you for that. And Harlem is really doing good considering all the stuff that they're going through. So I just want to say I'm very proud of all of you. We are very proud of all of you because without you, the hospitals really couldn't run without the CAB working closely with the nurses and the doctors and the patients. So thank you so much. Any old business? Any new business? Hearing none, I'm going to say to Mr. Akente, which way? You know, we are grateful to you. And Deb, she's not here. Keep the cabs going. And y'all are busy. I didn't realize you was doing so much work. And just keep it up because it really is growing. And I think the CAB understand a little better what their duties are and what it entails. So congratulations to you and Debbie. Keep it up. Thank you. And I just want to say too, my girl over there, her, you know, when you say Alethea and Josie and the team, thank you, because this is some hard work to do. So thank you. And since we have no new business or old business, hearing none, and before we adjourn, I just want to remind everyone that the next CRC meeting will be back on a Tuesday, January 6th at 5 p.m. And we're looking forward to hearing more presentations from you. And this time, I think when we come back, we have Carter, East, Kings County, and Queens. So on that note, thank you again. Keep up the good work and happy Thanksgiving, because we won't be so. Don't eat too much turkey now.
Thank you, Madam Chair.
Meeting adjourned. Thank
This meeting is no longer being recorded.
This meeting is being transcribed.